Okay, Heather, we've completed we completed the Perio chart, and I need to talk to you about a few things about some of the findings. Is that okay?
Mm-hmm. Sure.
Okay. We've been seeing you for quite a while, and I've been Perio charting every time that you've come in, and I'm noticing today that there's been some significant change within the supporting structures of your teeth. Do you remember from the last visit that I discussed with you some of the inflammation in your gums?
Mm-hmm. Yeah.
Okay. Have you been doing anything differently at home as far as your home care since that visit?
I don't know, maybe. I mean, sometimes maybe I don't brush 3 times a day like I should. I definitely don't floss like I should. I'm the worst about that. So maybe, I mean, that's pretty much the only real big difference.
Okay.
Which I'm sure is big.
It is. So what I'm hearing you say is probably you're not doing as much as you could at home with your home care since your last visit.
Yeah, I mean, sometimes, I don't brush after lunch always. I don't have a toothbrush in my purse, and nighttime I'm just too tired to floss. And I forget sometimes.
Okay. Well, I think I'd like to discuss some things with you that is in your best interest. Is that okay if we go ahead and do
Sure.
that now? Okay. Well, up in all areas of your mouth, actually, you do have some bleeding and some deep pocketing. And it's alarming to me as your healthcare provider because I want it's in your best interest that there's potential for you to lose more bone than some of the bone that you've already lost. Can you tell me what you know about periodontal disease?
Just what you've told me, and sometimes what I see on the commercials. I know that it's not good and it can make your teeth loose sometimes, and I've heard a couple people even say that they know people who've lost teeth completely. It's really bad, maybe bad breath, I don't know.
Yes, it's all of those things. So it seems like you have a pretty good understanding, a pretty good grasp on what periodontal disease is. And I see with your x-rays in the periodontal chart that it's getting worse. And so to inhibit this disease process from getting any worse, we need to do what is called periodontal therapy. And it's a deep cleaning. We can use a needle-free anesthetic, so you will be numb through the process.
Okay.
Okay, I know this is kind of unexpected.
Right.
So just stick with me, and then we can talk about how I can help you through this process. So we'll remove the deep pocket pathogens, okay, create a healthy environment so that the supporting structures are stronger, so that you don't have the potential of losing your teeth. Okay?
Okay. Well, when you say you're going to remove stuff, are you removing anything important from my mouth, or just like the bacteria?
Nothing important that you need.
Okay.
It's just the important stuff that you don't need.
Okay.
It's going to create a healthy environment for your teeth.
Is it going to hurt?
You might be a little sore afterwards, but during you won't. You won't. There shouldn't be any pain, and if there is, certainly stop.
Okay.
Stop me, and we'll start with a needle-free anesthetic. But then, if you're still sensitive, then we'll have the doctor come in and go ahead and get you numb with some Novocaine.
Yeah, that doesn't sound like fun for cleaning.
This is probably unexpected.
Definitely.
I'm sensing that you're pretty surprised about this.
Just a little bit, right.
Yeah. How can I help you feel better?
Tell me that I don't need to have it done.
Well, unfortunately, as your healthcare provider, you do need to have it done, and best case is that we start this process today so that we can eradicate the infection that's around your teeth.
Are you going to have to do it this way every single time that I come?
Nope, and I think, if you think back, we've been seeing you for, some continual visits.
Right.
And every time that you've been in, and help me remember correctly, that we have been educating, and reviewing and showing you areas of bleeding and showing you some things that you can do at home.
Right.
And unfortunately, it's come to a point where we need to do a little bit more.
Mm-hmm.
Does that make sense?
Yeah, so I mean, had I flossed better, would I still be in the same position, or would it be kind of iffy?
It's hard to say. Probably would have been areas that wouldn't have been so bad about it. Does that answer your question?
Yeah, I probably should have been better about flossing my teeth. All right, so do we have to do this today?
Well, best case, we should do it today.
Mm-hmm.
But
I know that
you weren't expecting it.
No, definitely not. I was expecting to get the regular old squeaky cleaning that I always get. How long is it going to take?
About an hour.
On top of all ready. I don't think I can do it today. You know, I gotta get my kids from school, and they have to go to dance, and then I have to take my son to basketball practice,
Yeah.
and I don't know. Can I do it a
understand.
different day?
You sound pretty busy.
Yeah, yeah. Can I do it a different day?
You can. You can certainly do it a different day, and we can schedule it during a time, that's more convenient for you. But I really want you to understand the importance of returning for that visit.
Can I do it my next visit? When I see you again in like 6 months, can I do it then? Can I wait until then?
What is, on a scale of 1 to 10, what is the importance of your oral health to you?
Well, I want to keep all my teeth, so I guess that would be pretty high, probably a 9 or an 8 or a 9 or a 10.
So with that, and I'm glad to hear you say that, but with that answer of wanting to be on the higher end, do you think it would be in your best interest to wait until 6 months?
Well, that's why I'm asking you. I mean, do you feel it's something that could wait until I come back for my next visit? I could go ahead and plan that time, or do I need to schedule something sooner? If I do, I have to arrange to make sure that somebody can watch my kids and pick them up and all that stuff.
Absolutely.
But, in your opinion, since you've been seeing me for a long time, would it be okay to wait, or should I do it sooner?
Well, best case is that we do it today, but I understand, and I'm hearing you say that, you can't today for other reasons, which is fine. But I'd like to get you in within the next couple of weeks to get this taken care of.
Okay.
Because the longer we wait, there's higher risk involved.
Okay, well, if we do it that way, then I can arrange for somebody to get my kids, and I can also mentally prepare myself for that, because
Sure.
I'm a little scared. That kind of freaks me out a little bit.
Yeah.
So, but as long as if I can do it a different day, then I'm good. I'll go ahead and do the treatment.
Okay. I don't want fear to inhibit you from coming back in.
Well, but I'm also afraid of losing my teeth. So fear of losing my teeth is going to outweigh fear of coming in and having this done. So I might as well just get it done and over with.
Okay. Good. Excellent. I'll probably call you once we schedule the appointment. I'll call you to remind you of your appointment so that you know the date and the time that it is scheduled. Before you leave today, we'll review the treatment plan, and if you will owe anything out of pocket from your insurance.
Oh, okay. I hadn't thought about that. Okay.
Okay?
I guess that's what I get for not flossing my teeth, huh?
That's okay. That's what I'm here for. Here for to hold you accountable and help you, and that's part of my job. So.
Okay, well, I guess I can go ahead and just schedule an appointment then.
Okay, let's get you scheduled.